What's the matter?
Oh, is he all right?
He's having a stroke.
What?
I'm genius!
A stroke occurs when there's a lack of blood to a portion of the brain, resulting in tissue death and loss of brain function. A stroke can be caused by a ruptured blood vessel, such as an aneurysm, or by an embolism, which is a small, free-floating clot or particle that becomes lodged in one of the arteries of the brain and interrupts blood flow. Depending on what area of the brain was affected, a stroke can cause speech impairments, paralysis, especially to the face, arms, and legs, unconsciousness, or even death. Signs and symptoms of a stroke include sudden weakness or numbness in your face, arm, and/or leg on one side of your body. Sudden dimness, blurring, or loss of vision, particularly in one eye. Loss of speech, trouble talking or understanding speech. Sudden severe headache with no apparent cause. Unexplained dizziness, trouble walking, and/or loss of coordination. To test a possible stroke victim, remember the first three letters of the word stroke, S-T-R. S for smile, T for talk, R for raise arms. Ask the victim to smile.
Can you smile?
The smile test is used to check for one-sided facial weakness, a classic sign of stroke. Ask the victim to talk and see if they can repeat a simple sentence such as, "Don't cry over spilled milk." This is used to check for slurring of speech, another classic sign. Ask the victim to close their eyes and raise their arms. Stroke victims usually cannot raise both arms to the same height and hold them there. If any one of these three tests is abnormal, the probability of stroke is 72%. A stroke is a true emergency. Employ the acronym AID. Document the time of onset. If breathing is present, place the victim on their affected side. Administer emergency oxygen. Continue to monitor breathing. The 2010 ECC guidelines state both out-of-hospital and in-hospital medical personnel should administer supplemental oxygen to hypoxic stroke victims or those with unknown oxygen saturation. You can reduce your risk of stroke by lowering the changeable risk factors. Changeable risk factors include high blood cholesterol or triglyceride levels, diabetes, high blood pressure, lack of physical activity, obesity, stress, heart disease, tobacco smoking. There are also unchangeable risk factors which include increasing age and heredity or family history of stroke. Males have a greater risk than women, and African Americans tend to have a higher risk than other racial groups.